had trouble finding a place to sleep. Sometimes I'd sleep outside, and I'd drink like non-beverage alcohol, like kind of hard stuff, and kind of hard to try to find a job and all that.
Harm reduction has taken a lot of different forms. I've seen it done well, I've seen it done poorly, and the managed alcohol program being operated by Boyle Community Services is indisputably the most sophisticated harm reduction program I've ever encountered. On top of that, the physical space is gorgeous. It centers the participant in a way that creates dignity, that creates peace, and that creates self-respect. The community-centered approach to harm reduction, where participants can get together and share stories and have a strengths-based approach to care, is transformative and represents best practices in a way that I haven't seen done this well anywhere else. The managed alcohol program has been an inspiration. It's something that I've taken back to the leadership team and my organization at Bissell and spoken very highly about, and done brainstorming around how we can take some of the amazing ideas that we've seen here and replicate from my vantage points from some of the programs I oversee. And that applies not just to day shelters or PSHs or these specific services that I oversee day to day, but also even nitty gritty into our data collection. One of the things that I've really been impressed by is how the managed alcohol program has consulted with their participants, with their client base, around what data gets collected, why it gets collected, how it's weighted, what it's used for, and having participants really evaluate the evaluation system has been really eye-opening, and I think really enriching. I think you get better quality data when you include the people who are being measured in determining those metrics.
This program supports people experiencing homelessness who regularly consume non-beverage alcohol. Participants of the program receive a daily allotment of wine, which they help brew. They are also supported to acquire identification, a regular income, physical and mental health supports, as well as housing.
But you usually get into the wrong alcohol. Hand sanitizer, rubbing alcohol, and that stuff. I've been drinking that for a long time. I started when I was drinking when I was about 5 or 6. Me and my older brothers and sisters, there's 12 of us in our family. 7 boys and 4 girls. But we started, me and my brothers, we started drinking homemade brew that my mom and dad used to make all the time. And they'd pass out and we'd get into their brew. And we'd pay for it. We'd be real sick that this is a good program, and I recommend it to a lot of people. So easy to lose your life drinking that stuff. That's how I lost my brother. He was drinking hairspray. And he had a heart attack from that stuff. And my older brother Norman, he'd drink rubbing alcohol, and something happened to his kidneys or something. In a way, it's kind of making me think. I want to sober up. I'm starting to think about, being a dad to my children and a grandpa to my grandchildren. Be around for them.
So the idea behind the managed alcohol program is we're providing a safe supply of alcohol to folks who are typically drinking non-beverage alcohol. And non-beverage alcohol can be anything from sanitizer, Listerine to hairspray. And in our case, we're providing wine to folks. What's really unique about our program is we're not just a dispense site, but the alcohol that we provide to our participants is brewed on site by community. It's bottled by community. It's a completely peer-led, peer-run program. So when we first started thinking about MAP and what this program could be and why that it was needed, I think our biggest expectation and our biggest hope was just that folks reduced their consumption of non-beverage alcohol. We seen how much this program was needed within the community. We were seeing the harm that it was doing to folks when they were consuming non-beverage. And so in terms of non-beverage consumption reduction, this program has exceeded our expectations. But what we've seen is that this program does so much more for people than provide safe supply. It's a point of connection for people. It's a community for folks that typically did not have a community prior. It's a safe place for people to go, and it's a program that's improved quality of life. One of the biggest outcomes, I would say, is housing. Over 80% of our participants are housed, and a lot of that is due to the work of our program. Most of our participants, upon intake to MAP, had a lot of instability with their housing, whether that was difficulties obtaining housing or maintaining housing, and a lot of that stemmed from their consumption. Those folks are now housed in a stable environment and more long-term. We also have a group of folks who, because of their non-beverage consumption, there's a lot of shame with that. There's shame whether it's how you're acquiring your non-bev or shame of how you behave when you've consumed non-bev. And that shame seeps into other areas of your life. And so a lot of folks presented to us with the feeling that they didn't deserve housing. And through the stability of MAP and the support of MAP, that feeling of unworthiness has gone, and folks are now wanting to explore housing and interested in housing and feel that they deserve housing. I think the change in quality of life for folks has been a huge outcome that we've seen. In terms of growth at Boyle Street, my hope is that this program thrives. I think, we've already expanded within a year. We have this great new space. We have doubled our program participants. And I think just seeing how beneficial this program has been to the lives of our community members that we work with, my hope is that we can continue to do that for others in the years to come.
My life was living on the streets, eating shelters, drinking unbeverages, alcohol, hand sanitizer, Listerine, hairsprays. That's the kind of life I lived on the streets. I love this program, and every time I'm downtown, I tell people about this program because it's a big help. I'm learning slowly for this math program, and I like their program that's drinking this wine. At least it's real. Hopefully it'll get my life back in order. I can finally look forward to leaving this place, Edmonton, and getting my life straightened out. And hopefully they find me a place to live instead of living in the shelters. Just because I live a long ways, young life, but I do want to go home, and I haven't been home in 20 some years. And I want to get off the streets, straighten my life out, go back to work for my uncle. It's the reason why this program has helped me a lot.
Just seeing the way that people respond when you're able to give them some options besides just one avenue, I've seen it, be something that really empowers people in the process of their wellness, and in the process of, with my program, the purpose of our program is to support people in working towards independence. And when I'm able to give my participants more choices, if they express to me that they want to change their relationship with alcohol in some way, maybe they've determined that it's problematic or chaotic in some sort of way. But the idea of going to treatment or going to detox or having to stay sober forever is this like huge thing for them, and it's not even something that they want or could wrap their head around in the moment. Being able to be like, there's another option as well. If you're just looking to manage your relationship with alcohol, you don't necessarily have to go to detox and treatment and do all of those sorts of things and make this huge change in your life. We can start here.
Well, they helped me get my IDs back. Now I'm being housed at a place called Urban Manor. It's an all-man shelter. They feed you there, they give you good beddings, they do your laundry. The staff here helps me get to my medical appointments, and I'll be getting glasses soon to help me clean my life up pretty good. It helps me feel better about my life in a positive way, helps me move forward, and actually makes me feel more confident about doing things.
The folks that we're serving probably are amongst the most stigmatized people in Edmonton that you'll come across. Folks consuming, rubbing alcohol, hairspray, hand sanitizer, things like that. And even at Boyle Street, where we're accustomed, I think, to helping the most vulnerable, I think we struggle to help this population. And I honestly think this is a group of people that's often viewed with disgust, disdain. So I think, first of all, to be able to offer them a real opportunity. And I think for many of them, it's the first real opportunity that they've had to change the narrative of their lives. It's been very powerful. We've really tried to do something different from the charity model, where clients kind of sit back and passively consume resources or services. In MAP, the participants are active players. They run this program beside the staff, right alongside the staff. And so with that, you see that sense of investment, that sense of purpose, that sense of pride and investment and belonging that comes. And so, yeah, we really see from there a sense of dignity and personal transformation set in. And that's just the most beautiful thing you'll ever see. We really start to see people dream, to be in a situation where you dream. And I think setting goals is obviously a huge thing, but that starts with dreaming and some belief in yourself, And so to see our participants dreaming about re-entering the workforce or to reconnecting with their family, or in one case to being a father to their child for the first time in their child's life, those are just such impactful kind of amazing, tremendous things to see. What we've learned too overall is a lot of the participants of MAP we knew at Boyle Street for years, and we thought they were relatively integrated into the community, We thought that they would have felt belonging in the community. We thought that they were working with one of our workers, and so things were okay. But once we started to engage with them here in this particular way, we found out they were feeling profoundly lonely and isolated and purposeless, And so it was a good lesson for us too at Boyle to be really intentional, to not make assumptions about who's coming into our building, to not just think, oh, that person seems relatively okay, or everyone knows their name, therefore they must not be lonely. Those can be dangerous assumptions, actually. And I think we've really learned that here, how really asking people how they're doing truly, and especially once we've lowered some of the stigma, and then asking them to help us set goals and to work alongside us to set those, to reach those goals. I think has been a tremendous learning for the entire organization. And as Boyle Street moves into its new building, I think you'll definitely see us incorporating some of the lessons we've learned at MAP across the board.
My life before the program was pretty difficult. I had nowhere to go. I was in a pretty bad relationship, and I was I was drinking a lot, stuff I wasn't supposed to be drinking, and I couldn't even get a job, and yeah, I had nowhere to go. Being in MAP is It's really helped me out a lot. Like I've got a place now. I'm housed. I'm going to. I've got this work program that I'm doing here on the computer, and they take me to my appointments, remind me about my appointments, and got a bus pass, and yeah, and they also help me get housed, so therefore I can actually get into a routine, which I'm getting in, thanks to them. Well, I'm just really grateful that I'm not drinking non-bev anymore. I've been cutting back on my drinking, and it's definitely moving forward. I hope to continue moving forward thanks to this program.
I think there's been so many successes, and success looks different for everybody. I think one of the biggest ones that stands out for me, though, is there's a participant who is in MAP, and this is someone that I've known for 6 years. And they disclosed one day that they had a son. And this is something that nobody knew. None of his caseworkers knew, none of his supports knew, and that he had been trying to locate this son. And through conversation, why now? What are you hoping for? He expressed that, for the first time in his life, he felt that he was stable enough to be a dad and to be in his son's life, and that was not something that he had ever felt before. And so our team worked to locate his son, and we were able to arrange a visit. And so the CFS worker came to our office and met with this participant and met with staff. We took him to a visit with his son. He hadn't seen his son in 8 years. They ran to each other, they hugged each other, they told each other how much they loved each other. And I think for our community, often that's not an experience that they get. I think it was really the highlight of this program and why we work so hard with our folks. For someone who nobody even knew he had a son, to feel like now he could not only say that I have a son, but say, I think I could be in my son's life, has just been so impactful and so beautiful, I think, of what this program can do when we provide safe, consistent, non-judgmental support for people.
The one participant I'm thinking of in particular, he has been involved with the housing program for a number of years. I think probably like 4 or 5 years. He ended up coming over to my caseload, and I work with more of like an intensive housing team. When I got him on my caseload back in, I think it was the fall of 2021, and just seeing how much his quality of life has improved since connecting with MAP. I have to give him also a lot of credit for having, the drive and the desire to want to connect with a program like MAP, but MAP has made it so easy for him to, just plug in and get as much out of this program as he's wanted to get out of it. And seeing how he's benefited from their peer support group, seeing how he's benefited from their mental health support that they have to offer, and just seeing him, hearing what he shares with me about, being involved in the whole process with making the wine and being involved in community in so many different ways here. He's able to make friends here and be here and connect with those folks. And now that he's not always so worried about if he's going to have enough money for alcohol, where he's going to get his next drink from, all of this kind of stuff, he can actually focus on, the other things that make him who he is as a person. And I've just seen so much growth in him as a result of being connected with this program.